interns and residents to go out into communities, underserved areas, even within the city of Riverside. There are areas with very poor health care, preventative care, kids are not getting their shots on time, and so forth. To go out in these communities and hopefully to remain there. Often the choice of a physician is where they want to settle down is based on where they did their residency. The county hospital itself is preparing for this as one of the prime teaching hospitals, and we just had the county hospital rated highest in patient satisfaction of any hospital in the whole region. And our director, Mr. Bagley, tells me that the system that I suggested here a couple of years ago for them to start measuring their performance internally, core measurements, which is outlined in these charts, has helped them raise their standard of care so that they could receive this very, very high rating. There's a lot more that we can and should do with healthcare. For instance, the county's ambulance services now are assigned the task of going out and picking up what we call 5150s, people who are mentally ill on the streets, often not just a danger to themselves, but a danger, often to police and other bystanders who engage them, unfortunately, without proper training. We're going out with ambulances now on a kind of a medical mission that is ill-suited to deal with people with severe mental problems who are on our streets daily and at night. It's one of the most dangerous situations there is. Other counties have a much more progressive approach in dealing with this issue. We need to adopt that. Other counties use vans. They use specially trained people that not full psychiatrists are getting very expensive. There's a great demand for them out of state, but that are trained in this so that they can go out and hopefully get there before the police do or as the police do to more intelligently, humanely deal with people on the street. We need more outreach in this county. It was always striking to me that certain countries who are very abjectly poor, like Haiti, actually have better outcomes for AIDS patients because they have community workers who go out to the patient in the community and make sure they're taking their meds. We don't have that here. We're behind in a lot of ways that we handle health care, let alone the great gaps that we have in it. This is an area where there's bipartisan, across the board, widespread support for improvements here. And we need to coordinate those often with our schools and training facilities. One of the key problems here, you all know, we don't have enough nurses. It's a statewide, nationwide problem. We're trying to improve training, work with a community college. They don't get enough money for expensive nursing training. We're trying to pull ourselves up by the bootstraps, but we need a more systematic and determined approach. We don't have enough lab techs, for instance. We're offering higher paid lab techs at the county hospital. We're trying to encourage our own county workers to use our own HMO called exclusive care, which is lower in cost, that uses the county hospital and our clinics as primary places to get urgent care or emergency care, so that we're all part of this system and we all experience it. I'm a member of urgent care, or of exclusive care, and I go to the county hospital or the clinics. Thank you.